Hello everyone, my name is Dr. Charles Vang. In this presentation we will be going over the coronavirus or COVID-19 etiology, or where the virus stemmed or came from. Going forward, I will refer to the coronavirus or the COVID-19 infection as COVID-19. COVID-19 can cause mild symptoms such as a simple cold up to a severe pneumonia. The illness is like the severe acute respiratory syndrome or the SARS coronavirus and the influenza. The coronavirus looks like a tennis ball with spikes around the entire shell. The spikes are kind of like a crown-like projection that attaches itself to the lungs. The virus can attach to different organs in the body, but this virus specifically attaches to the lungs and deposits in information to make duplicates of itself. The virus uses our body system to create more of itself. The virus has been found in saliva, blood, urine, and stool. So how is COVID-19 and influenza viruses similar? They are similar in two ways. First, they both manifest through the respiratory system or the lungs or airway system, ranging from no symptoms or mild to severe illness and sometimes death. They both can cause fevers, cough, body aches, and pain and fatigue, as well as resulting in pneumonia. Second, they both are transmitted through contact, droplets, and fomites. Fomites are things that you can touch, and the fomite can contain the virus and potentially spread it to you if you touch that object, such as a doorknob or a phone. Therefore, when looking at how the COVID-19 and influenza viruses are similar, we can use the same public health measures to prevent infections, such as appropriate hand hygiene, like washing your hands well, and proper respiratory hygiene, such as covering your cough or sneeze. The spread of the disease or the virus is an important difference between the two. So in some cases with COVID-19, it seems like the incubation period, or the time where you contact the virus or you come into contact with the virus, and the time when you get sick is somewhere between 1 and 14 days. But what we've been seeing is that most cases start having symptoms around days 4 or 5 after exposure. Now, in influenza, the incubation period is shorter, and it ends up being about 3 days from the time of exposure to the time of people starting to show symptoms. So when you take a look at it, influenza seems to overall have a shorter incubation period compared to the COVID-19. Existing data demonstrates that children are less likely to contract COVID-19. However, keep in mind that anyone is susceptible or can get the infection. The research has shown that older individuals with underlying health concerns or conditions are more likely to be affected by COVID-19. In regards to influenza, children are the driving force of spreading the disease. The ones more likely to be affected by influenza are children, pregnant women, and the elders who already have underlying chronic conditions. The information collected up to date points that COVID-19's mortality rate, or the rate of people dying, is higher than seasonal influenza. Keep in mind that further study is still needed to understand the mortality rate of COVID-19. However, from what is seen, the mortality rate is 3 to 4%. As for seasonal influenza, the mortality rate is usually at 0.1%. So about 1 in 1,000 individuals will die if they contract influenza. Keep in mind that mortality is partly referenced based on the easy access and quality of medical treatments. So, for example, with the COVID-19 infection, testing has been somewhat difficult, and so the numbers that are being used are probably underscoring the number of actual cases or individuals who have been affected by the COVID-19 infection. At the same time, quality of medical treatments is important because individuals who, say, get seasonal influenza, for the most part, will have access to appropriate treatment and, if needed, ICU and ventilators. In regards to the COVID-19 infection, due to this virus being a new infection, the access to quality medical cares and ventilation and ICUs has been somewhat limited, and thus is one of the primary concerns about how this can affect the mortality rate for COVID-19 infections. So, where did this coronavirus or COVID-19 come from? In general, as a class of viruses, the coronavirus is common in certain animals. And this one in particular, the COVID-19, was noted to have come from Wuhan, China, in a seafood market that was selling different live birds and meats from unfamiliar animals. The researchers thus far have tracked the virus coming from a bat, and the virus was transmitted from that bat to a human. Eventually, family members and healthcare workers were starting to show similar symptoms because they were caring or they were around the ill patient. So this revealed that the virus went from having the capability of being transmitted from an animal to a person and then going from a person to another person. So human-human transmission. So how does coronavirus or the COVID-19 infection get spread? Right now, it is uncertain exactly how the virus spreads from person to person, and that's due to this virus being new. But from what we can tell and from reliable resources, it seems like the most common way to contract the COVID-19 infection is through droplets from a contaminated person that uses improper respiratory hygiene, such as if they are coughing or sneezing and not covering their cough or their sneeze appropriately. Even talking can actually spread the virus, since there is a small amount of saliva that can be projected during the course of conversation. Individuals who are nearby may inhale these droplets that then gets directed to the lungs and then causes the infection. Having close personal interaction, such as shaking hands or by touching fomite, so things that can that the virus can land on and survive on, and then if you touch that and touch yourself in your eyes, nose, or mouth, then you can potentially get the infection. Lastly, airborne is possible in certain situations in areas where medical tools are used, such as if doctors are doing a bronchoscopy where they're taking a tube and checking the aerial passages in the lungs, or if they're intubating or using ventilations. Airborne transmission is different from droplets in that in airborne transmission, the size of these droplets is much smaller. The droplets tend to last longer in the air, and the spread can be at greater than 3 feet. At this time, there's not enough information to determine if the virus can be transmitted through breast milk, though ongoing research is occurring. So in terms of the viability or the ability for the virus to survive outside of the body if it lands on something else can vary based on what it lands on. For example, if the virus in a droplet lands on something that's plastic, the virus can be viable for up to 72 hours, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. In regards to infectivity, or how the infection can be, how many people can be affected, if a person is infected with the COVID-19 virus, from the data that we have thus far, it seems like 2 to 3 people can become infected. In general, this is higher than for influenza. At this time, it's unclear if there's a mother-to-child transmission during pregnancy, but like many of the data or information, there are ongoing studies.